Hey guys, welcome to episode 24 of the What Comes to Mind series, and today we are talking about COVID-19, something we have all heard before and all know in this current time, but it's from a perspective you probably haven't heard before. So I hope you enjoy the episode and take some benefit from an interesting perspective. And with this episode, there's going to be a lot of timestamps that are in the description box below. See it as a guide for the video you can snapshot and go to whichever point you want to, as opposed to getting scared because there'll be quite a lot of timestamps. But let's start. What is coronavirus? Now, the word corona is actually linked to how it looks under a microscope, because the word corona is actually linked to the word crown, and coronavirus is termed that because it's something called an envelope virus. It means it can attach to surfaces, but thankfully it can be removed and discarded through disinfectant. Now, it's termed this invisible killer because it is the size of 1/100th of a human hair. That shows you how devastating something so microscopic can be. As we know, how much it's caused problems around the entire world in so many facets. However, unfortunately, this is not the first coronavirus strain. There are many more before, and it's part of a family of viruses that are linked to the common cold, linked to the MERS virus, also linked to the SARS virus. So MERS meaning Middle East Respiratory Syndrome, and SARS, which is Severe Acute Respiratory Syndrome. Now, in terms of classification, the current crisis that we have is actually termed SARS coronavirus 2, SARS-CoV-2. Now, to give you an insight as to why this is not the first coronavirus strain, Professor Ian Jones in the University of Reading actually termed that 15 to 30% of common colds are actually due to a form of coronavirus, but not the one we have, but a form of it. And many of the other percentages are due to a different family of viruses known as the rhinovirus. But the real question is, why is it so dangerous? Why is it such a problem at the moment? One of the main reasons why, it was actually termed a novel zoonotic strain. Novel meaning it's new, it's never been looked at before or found before, and zoonotic actually means a transmission from animal to human. And that's one of the biggest reasons this COVID-19 strain is so deadly and so severe. It's because we actually have no immunity to it. It's something we as humans and our immunological profile hasn't experienced before or met before. So that's why it's such a huge problem when those who have been infected, and hopefully not many more, encounter such big problems when they experience this infection. It's because the body's like, what is this? I've not experienced anything like it before. And that's why it's such a problem. Now, I mentioned about deadly strains from before, but what were those strains before? What were those actual viruses before that were a huge problem? How can we actually learn from them? Were they recent? Were they old? So the biggest was back in 1918, something known as the Spanish flu. And back then, over 500 million cases were reported. But the reason why that's so alarming is back then, the knowledge of virology, about vaccines, about epidemiology, so this R infection, wasn't really known back then. And that's why it was such a problem, because in wartime situations, soldiers were actually carrying the virus and shedding it to the places where they actually had combats. So that's why it spread without realizing. And 50 million deaths occurred from the virus alone. And people argued the virus was actually more of a problem than the war itself in terms of mortality. And that's quite a big statement to say that something we can't see caused that many deaths worldwide back in 1918. Now, between 2002 and 2004, we had the SARS virus. So this is currently what we have is COVID-19, so SARS-CoV-2. But 2004, we have CoV-1. And even though over 8,000 cases were reported and less than 1,000 deaths, virologists back then termed that the virus itself didn't have the, let's say, the stamina to stay in human population long enough to cause more of a problem. Unfortunately, this one, because of its zoonotic strain, i.e. we don't have any immunity to start with, that's why this strain has become more deadly than the one back in 2002 to 2004. In 2009, we had the H1N1 pandemic, a flu pandemic that was quite severe, but not as severe as the Spanish flu, which was nearly over a century ago. That was a new strain which caused a lot of problems like the strain we have currently right now. But because of antivirals, because of vaccines that were quickly introduced within a year, the amount of cases were only 24% of the world's population, which does sound a lot, but mortality rates weren't as high because only 280,000 cases were actually reported. And what I mean by that, it's in comparison to the Spanish flu, because back then, no antivirals, no vaccines, the war made it worse, maybe poor hygiene, poor diet, etc. All of those factors which we are better at now really increased the transmission and the mortality rate back then. But now, in 2009 at least, it wasn't as severe. But as we know, any death is a tragedy. 280,000 is still quite a lot. Talking about severity, one of the most severe viruses we've ever faced was between 2014 and 2016 when we had the Ebola crisis. Now, this virus was one of the most severe we've ever seen in terms of once it infects somebody, the symptoms, the conditions are so devastating that it's shocking to see how dangerous it actually was. But the good thing about it back then was it wasn't as contagious as some of the viruses that we see now, because it was only be able to transmit it through bodily fluids, so through sweat and through blood. To minimizing the contact with that, minimize the transmission of the virus and by therefore the survival of the virus long term. So only, I think, less than 20,000 cases were actually reported, but over 10,000 deaths were actually seen. So it was quite severe, whoever actually unfortunately got it. But thankfully, through antivirals, through minimizing actual contact, not just about medications, about therapy, but minimize actual contact, reduce the survival of that very, very severe virus, Ebola. And unfortunately now, we come to the present day, COVID-19. 9 million cases reported worldwide, and unfortunately over 450,000 deaths worldwide. It is transmitted through respiratory droplets and through contact, and we all know unfortunately the many symptoms that can occur similar to the common cold and the first SARS virus back in 2002. Hence why I'm not going into actual symptoms. But here's the actual perspective that I'm very interested to share in today's episode. Thank you for those who have stayed with me through this little bit of information. Now I hope you enjoy this little bit of an insight as to why research is so important. Now this journey won't just cover science related topics, but also those type of research we probably don't appreciate enough, me included, that have made a huge difference to how we tackle this particular pandemic. I'll start off with the science research and go into those which we haven't heard enough about. So number one, cell biology. How does a virus bind to our cells in our bodies? How does it get inside? What way does it use to actually replicate? How does it cause the problems that we see? That's why cell biology is really needed. What type of genes are found on this or inside this virus, or what kind of genes cause the problems that we see? All of that is related to cell biology. Number two, what my kind of current trade is, my expertise, is immunology. How does the virus affect our immune system? How can we boost our immune system to try and tackle it? How can we develop immunity towards the virus quicker? You know, you've probably heard in the news this particular steroid known as dexamethasone. It's used in immunology to treat people who have severe asthma. It's now being used in low doses to try and mitigate the circumstances and the conditions that arise from COVID-19. Number three, virology. The classification of this actual virus. How does it look under a microscope? We know now it's a term of coronavirus, so we can link it to the other strains that we have and better understand from history how to deal with this type of actual epidemic. That's why virology is such a huge thing at the moment. Virologists are looking at different parts of the RNA, so different types of the genetic structure inside the virus, and how is it similar or dissimilar to the ones that we had before, so we can better equip ourselves in how to actually best combat it. That's why virology is so important at the moment. Number four, pharmacology. What type of medications can we actually use? What type of antivirals or immunological drugs can we use to bind to the virus so it doesn't actually get into our actual host cell? And there's researchers looking at that at the moment. You know, what protein can we make that binds to the virus so it actually can't replicate and actually cause the problems? You know, all the blood pressure medications to try and limit the increase in blood pressure that occurs, the inflammation that can generally occur, improving our ability to breathe, because we know the respiratory effects that this particular COVID-19 virus causes. So what treatments can we use and how best to use that treatment in what particular situation? Number five is actually medicinal chemistry. So designing and looking at the actual drug or medications that could actually help. Not just giving them to the actual patient, but designing them in the lab, which is actually what I first started when I did my PhD, was making compounds in the lab that could potentially have some therapeutic benefit. There's chemists looking at that right now in the lab, figuring out what can we do to improve some of the medications we have, so it's more targeted for this particular virus. And that's why other fields that I talked about earlier were really important. So the better we understand why this virus is what it is, the better we can target it and the better we can try and get it out of our system as quickly as possible. Think about the field, number six, the field of drug delivery. How can we get that drug into the body a lot quicker, a lot more effective? How can we get it through so it actually targets a particular area in our body? You know, that's a whole different research area that links with the other ones that I've just talked about. Drug delivery, a huge thing at the moment, especially for those who can't breathe. How can we get into their system quicker and more effectively? It's a whole different remit. Drug delivery. Number 7, and by far one of the biggest fields in research at the moment right now for this virus, is epidemiology. Looking at the distribution, the control of the virus. Where does it move? Who does what does it target? The rate of infection, those graphs that we see when we watch the news, all from the study of epidemiology. Number 8, something a bit different, is clinical nursing. How to triage patients, how to look at patients and assess their severity. How can we do that more effectively in a pandemic situation where we have mass amount of patients, a very high stress environment? How can we figure out a way to do that even better, even more effectively? That comes from the notion of research. Medical engineering. There was a shortage of ventilators at one point during this epidemic, and engineers had to figure out a way to make ventilators fast with minimal resources than they normally actually have. So companies like Dyson's, who are known for making hoovers and vacuum cleaners, were a big part of making the new ventilators that are helping society at the moment. So engineers were a crucial part of the epidemic that we have, not just the scientists or the natural scientists that we normally see in the laboratory. Researching global logistics, the people who are looking after, you can say, ports, are figuring out what's the most effective way we can get things from around the world to different parts of the country or different countries in general. And there's a whole research about what's the most effective method, what different methods can we use, especially during a very difficult pandemic situation. Those people, especially if you figure out a lot of medications that are not made in the UK or in the country that you're in, and they have to come from different countries, what's the most effective and most safe way to actually do that? Global logistics is a huge research point that is integral to the fight against COVID-19. Another one which is really important is HR, human resources. Getting the right personnel to the right place at the right time, especially during a very fast, high stress, highly unstable and very changing, evolving situation. You know, getting the right doctors, the right nurses, the right consultants, getting the right people who are key figureheads in different societies and businesses, how to get them in the right situation to make key policies related to that city. HR is a huge thing, you know, not just laboratory scientists running tests on actual patients. And lastly, politics, research in politics. What's the most fast and effective way to fast track policies so we can get key decisions in the government made a lot quicker? The people who are professors in politics figure out what's the most fair way to get an objective decision that's fair for society, even though we're in a very difficult emergency situation. Those people helping to fast track policies, whether it's implementing a new law or removing a law that's hindering stuff at the moment. That type of research is also really useful too. So guys, I hope that was a little bit of an insight to the importance of various types of research in society that are pivotal not just for this crisis but life in general. Earlier, we should see over here, I think, it's a research episode I did purely on the wonders of research. But this gives an nice idea of the actual research in an applied setting right now, a real life setting. And you can see the variety of the different research topics that I've covered. There are many more. You know, if you want me to do an episode on that, please let me know. But there are many more that are crucial to the actual pandemic we have right now. Guys, I know this was a bit of a more delicate and more sensitive topic. I hope you did enjoy and did benefit from some of the information that I shared. Make sure we try and stay positive, we keep safe, make sure we smile. See if you can beat that. It was quite big, you have to admit. So I hope you enjoyed the video. Episode 25 will be tomorrow, so stay tuned and make sure you smile.